Hi, I'm Dr. Donna Robinson. I'm a medical doctor. I've been in Thailand for 30 years. Again, I'm showing my age. So I got the Thai medical license in 1998 and I've been working here. I do work at Bumrungrad too, and I opened the clinic MedConsult in 2008, and I'm from UK, married with 2 now grown-up children. Well, how does it spread? It spreads through droplets, which could be from the nose, it could be from the mouth, it could even be from touching, and it can also stay alive for a certain number of days even on a surface. That's a good question. Well, we've seen, first of all, the countries that were really strict on wearing a mask in the early days, the levels of transmission were much lower. So COVID virus didn't spread by wearing this simple mask. The question about children and exemption, yes, it is shown in that perhaps children under 2, 3 can be exempt from wearing a mask. And why? Because it could be difficult for them to breathe, their sinuses, their nose, it's much less well developed, and it could actually be really difficult for them to breathe wearing a mask. I think we all know who is vulnerable. The elderly, those over 60, 70, 80, and actually that's why we've started to protect those people as a priority in different countries and vaccinate them first. The over the 80-year-olds, the 70s, then the 60s, and dropping down and down. And not only age, but those with chronic diseases. That really makes you much more vulnerable to the coronavirus. And chronic diseases, things like diabetes, asthma, breathing problems. If you have a rheumatological problem, you're immunosuppressed, or cancer, all these conditions make you much more vulnerable. And of course, as we get older, we get more diseases. That's another good question. Well, we have seen, or we've had teleconferences with people with COVID virus. So we're talking to them, they've been positive, they're staying in their home. What is it like? Well, it's definitely much worse than the flu virus. And what strikes me is the symptoms last much longer. And they can even have a fever up to 10 days afterwards, and have a cough, a sore throat. The other symptoms, like the lack of sense of smell and taste, again, that's different to the flu virus. But the way the symptoms really go on and on for well past a week to 2 weeks, that there seems to be unrelenting. And then it takes quite a long time to recover, because a lot of people want to have even blood tests a month afterwards, just to see, well, am I recovering? And it's shown that the inflammatory markers that we do stay elevated for much longer. So it's a pretty nasty illness to get. What should you do? Well, you may be worried. What should you do? You need to, first of all, is isolate yourself, because it's the vulnerable. If you are healthy, it's the vulnerable or people around you with illnesses. So you really need to isolate if you can. If you can't, we know that the government can provide you hospitals and rooms, or if you're really sick, you will always be admitted to hospital. But we've seen now the numbers, fortunately, in Thailand are dropping. Other people too who really want to self-isolate, they can monitor their own oxygen at home with these little, have I got one, an oxygen monitor? People find this really useful. Monitoring their pulse and blood pressure, that's helpful as well. We do know the vaccines are safe. They've been provided already on millions of people. And look, what is a vaccine? It's a tiny particle similar to the actual virus. It could be a part of a protein or RNA, DNA, and it's a minuscule, microscopic, and it's safely produced and it's injected into your arm, into this muscle. So how is this tiny injection of a tiny particle really going to cause you harm compared with getting COVID? Of course, it makes great news, and there are some evidence, as with all medicines or vaccines, that there's been some side effects. And it sells newspapers, it sells news if people report they have had a serious side effect. The anti-vaxxers, I'm afraid, getting the vaccine to protect ourselves, but also other people around us who are much sicker than us or have more illnesses. So really, I can't actually understand the anti-vaxxers. And I've had 3 vaccines, and here I am. I feel pretty healthy.